Thank you very much, Madam Speaker. Madam Speaker, thank you and to the House for allowing us to discuss a definite matter of urgent public importance, namely the government's implementation of their mass public vaccination problem. Mr. Speaker, the Minister of Health indicated some time ago that he shed a tear. I think today he will be shedding more tears. It is clear that in order for TNT to vaccinate, Minister Diyal Singh must vacate his office. When it is that a public official has to apologize unreservedly for reckless endangerment of citizens of this country in the height of a COVID pandemic, then it is clear that the minister should resign. In this regard, Minister, I have drafted a letter for you of your resignation, which I'll be happy to share with you at some point in time. But I think it is clear that your apology today is proof that you need to vacate this office at the earliest opportunity. And why do I say that? Yes, we want the vaccines. Yes, we want the population to be vaccinated. We've called for this from day one. But when you open the Daily Express today's paper, the minister really was inviting everyone, come one, come all, for the vaccines. The minister said on the front page, walk-in vaccines, crowd control, security in place. And none of that happened today, Madam Speaker. None of that happened. Crowd control, security in place. What happened instead? And I read from an article by Carolyn Kisoon in today's Express as well. Confusion. Mass vaccine call leads to mass confusion. The Health Ministry's call for citizens to come to health facilities today for the vaccination on a first-come, first-served basis has led to mass confusion. Crowds have been reported in Chaguanas, Brincestown, Gaspereau, Chaguanas, with people expressing anger that the health officials had not organized it in a more humane system. Police officers were called out to health centers, and in Princestown, loudspeakers and sirens were used, with officers asking that people social distance and form a line. In St. Madeleine, hundreds were turned away after the police told the crowd that only 60 persons would be vaccinated. And this is why I say it's reckless to tell everyone, come out, when you only have 60 vaccines there for members of the public. In Princestown, those gathered were told only 150 would be vaccinated today. Some said they were in line from early as 5 a.m., only to be sent home without a vaccine after waiting more than 3 hours. You know, I recall the Honourable Prime Minister telling us in this House, where in any country in the CARICOM that you have mass gatherings and so on and vigils, so where in any country where in the middle of a pandemic you have state-sponsored super spreader event. That is what this was, a state-sponsored super spreader event on the invitation of the government and the Minister of Health. Madam Speaker, the Minister apologizes, but this is too little too late. That apology, will it help us when we see what results from the gatherings that took place? And I'm not sure, Honourable Madam Speaker, if you may have had an opportunity to see the videos that we're sharing all day, where persons were grouped in these large gatherings, very closely put together. In fact, the Commissioner of Police had to come out and put out a press release indicating, and I quote from that press release, June 9th, 2021, COP, police dispersed crowds at vaccination sites. Police officers in several divisions had to disperse thousands of people who had assembled outside health centers this morning to receive the COVID-19 vaccines. It became very clear early that persons, many of them elderly, began assembling outside the sites around 6 a.m. to receive their vaccine. The vaccination rollout was being done as first come, first serve. By 9 a.m., videos and photographs reveal crowds of persons waiting in long lines with absolutely no social distances. So this state-sponsored super spreader event indeed erupted into breaking the very law that the government had put into place. That is to say, under the various regulations, that the law was being broken on the invitation of the government. As soon as the Commissioner of Police became aware of the situation, he gave instructions that officers of the TTPS take charge of the situation in the various divisions, and it became necessary to shut down these sites for the day. So are we coming back now tomorrow? We have been told they'll come back A to E. Now this was a policy decision, it seems to me, taken on hoof, because when this situation erupted, shortly thereafter, the Minister of Health is telling the country through press statements that, okay, we'll come back tomorrow, A to E. Has the minister done any kind of due diligence to determine how many persons will fall under the letters A to E? Do we know how many persons you're calling out under the letters A to E? The surname A. The surname A has a very large number of persons under A, the letter A. And so, do we know how many these are and how many will be coming? Someone is just whispering. Will you tell them they'll have their chance? Madam Speaker, please. You will have your chance to respond, as will anyone else, given the constraints that we have at the time. And so, the Commissioner of Police has said this, but listen to what he also said. The Commissioner says he will be meeting with health officials today to ensure that a better system is put in place for the vaccine rollout in the future. So here it is, instantly this has happened, a new policy is announced. Forget the first come, first serve. Instead, we're going to take you A to E. But how many people tomorrow will come out with A to E? And where will they come out? And there will be consequences. We see already today the death rate is higher than yesterday. We see also the number of infected cases very high still. Although we are in lockdown, it's really a kind of lickdown going on here now. We're supposed to be in lockdown, but people are being invited to break the law. So there must be consequences. Is it that we are going to see 10 to 14 days from today spikes in the infection rates? Is it that we are going to see more deaths? This is what happened after Easter when everybody was invited, welcome to Tobago, everybody come to Tobago. Do you know what's happening when there were no cases in Tobago now? From that Easter weekend coming forward, those cases have risen in Tobago, the death numbers as well as the infection rates. So what are the consequences? And if the government is thinking forward, what are we going to do in respect to what could result from the large gatherings that took place today? What can we do? Is it that we are going to be testing less, or should we not be testing more? We should ramp up the testing, Madam Speaker, so that we can reach our citizens before we wait for the persons to come down with the infections or actually to die. COVID kills, you know, Madam Speaker, as we all know. COVID kills. Now, whilst I'm here complaining about it, I would like to share, you know, we have suggestions. We can see what people have done in other parts of the world. We can learn. We don't have to reinvent the wheel. And so we can get some examples, things that are happening elsewhere, where we can do a better job at rolling out the vaccines. Yes, we must roll out the vaccines. Yes, we must get herd immunity. It's the only way, which we've said all along. I would tell you this, you know, if I were Prime Minister today, we would have a clear pandemic plan. We would have had that and have it been implemented. This government has produced no plan. It's a vaps, vikey, vike. They make it up on the hoof. As they go along, you have no real plan to deal with the actual pandemic and to deal with the fallout and the suffering coming out of that. We would have a plan that would ensure that vaccines were sourced very early to prevent the death of hundreds and to ensure swift reopening of the economy. We would have a mass vaccination drive so that herd immunity can be achieved without putting citizens at risk. We would put into place a drive-through vaccine. Why can't we have drive-through? We have very large venues in this country, unutilized, underutilized, with large parking spaces, big open spaces to allow the social distances. Honourable Speaker, may I ask, by the way, can the Honourable Minister of Health indicate which of his colleagues received their second vaccine dose via a drive-through arrangement? And why would they give him that special treatment when nobody else has been given it? Old people lining up there from 5 o'clock this morning, tell them, go home, come back tomorrow, ATE. If the minister cannot say which colleague, then all I can tell him is that it was planned and is a developing story as to who took the vaccine. We will look to have partnerships. I keep talking about partnerships with private hospitals and doctors to have vaccines available at their facilities. We will have partnerships with religious bodies, medical staff deployed at large churches, mosques, temples, and so on to help in this rollout. Partners with NGOs such as Living Waters and others to reach the immigrant population, because we have a large immigrant population or migrant, whatever we may want to call them. And we do know some of the NGOs interface with them. Partnerships with corporate T&T. Partnership with the opposition, local government bodies to have a vaccination rollout in all 41 constituencies. Partnership with sporting bodies to volunteer and have a drive-through vaccination. Partnership with denominational school boards to utilize their schools to have teachers and principals inoculated. Let's see what some other countries have done. Other countries have done a lot of things to get their vaccination drive going. Utilizing unused structures to better accommodate social distancing. Bringing vaccines to the elderly and not just making them line up outside to be berated by police officers. Have vaccines available in pharmacies, large retail outlets, public transport hubs. This is happening elsewhere. We are not reinventing the wheel. Vaccines available. You could go in the United States to CVS. In fact, I'm told a lot of trainees, or some trainees, are indeed traveling to the US to go and take the vaccine and come back. In pharmacies, outlets, public transport hubs. We can look how well organized and executed the local private sector-led vaccination programs were done over the past few days. Why don't we engage the private sector? What is the fare of the private sector? Government, you cannot do it alone. You have shown you have failed, you've tried and you failed. You need to partner and engage many more organizations. You tell us we are all in this together, but then you want to try to do it alone and then you're failing. That is very, very clear. The 2 mass vaccination sites mobilized in quick time with proper facilities for persons coming to get their vaccine shot, done by local private sector-led organizations. We could also look at, Madam Speaker, several other initiatives. We can learn from others. As I say, we do not need to reinvent the wheel. And so, in some of it, the opposition believes that the nation witnessed this morning, what we witnessed is totally unacceptable. The Prime Minister cannot dither as he has done before. He must act now. Minister Diyal Singh must be replaced now. And if the Prime Minister cannot do the honourable thing, I call on the Minister of Health, show some national remorse. You must walk up with your resignation letter, walk up with your towel to shed all your tears, because now you really have something to cry about. Madam Speaker, the opposition takes no joy in bringing this motion. I think a lot of people were very happy that more people were going to get vaccinated. You know, there was a sense of hope based on the pronouncements made. But instead, what we are already seeing, you know, some government members or their activists, they're already coming out there to say to blame the population. The government is giving you a vaccine drive. The government is helping you to get this vaccine. But look at you all. You're behaving so badly. It's your fault. Buff the people, blame the people. That is what has been happening throughout this pandemic. Buff the people, blame the people. Come back and blame Kamala and go back and buff the people. Blame people and come back and blame the opposition for your incompetence and mismanagement. Madam Speaker, you know, many of us here were offered the vaccine because we were politicians. We were told that, well, we could go take the vaccine as politicians. But many people were not given that facility Thousands of people in far greater need and far more vulnerable were not offered that opportunity. Instead, come line up, stand up outside from 5 a.m., go home, come back tomorrow, come back next week, come back whenever. And yet, as politicians, we were told we would be given preference. I don't agree with that policy. Our members were given the option. That is your personal option. You take it or leave it. But we have to work together to make sure that we do this vaccination drive and roll it out properly. And of course, again, aggressively pursue obtaining, procuring the relevant vaccines. I thank you very much, Madam Speaker.
Minister of Health.
Thank you. Thank you very much, Madam Speaker. Madam Speaker, in responding to my honourable colleague, let me just repeat what I said this morning at the press conference. The country got an unreserved apology from me this morning. But let us deal with the facts of this motion now. The honourable member said, "Come one, come all." We have always been following a careful vaccination plan. Phase 1, healthcare workers and those in our NCD clinics. Phase 2, a more targeted approach, healthcare workers, those in our clinics and essential workers. We have not yet moved to phase 3. So what the honourable member was saying, come one, come all, is simply not what was the intention. It was never a total call-out. We were very specific in saying persons over 60 come out and persons under 60 with comorbidities. What are the factors that led to what happened this morning? 1, contrary to what has been reported for the past few months, and even an MFO poll published in one newspaper spoke to a high degree of vaccine hesitancy. Even they got it wrong. What is happening in Trinidad now, and we are happy for it, let's be happy, because the opposite could have been no one turning up for a vaccine. There's a high degree of vaccine acceptance. Madam Speaker, as all countries grapple with COVID-19 and grapple with the fact that leading up to these events this morning, vaccine supply was outstripped by vaccine demand. One country close to us, I wouldn't call the name, the names aren't important, had to suspend their vaccine blitz due to high demand. And they had to put out a press release suspending their vaccine blitz. They just couldn't cope with demand. And I quote that press release, "Walk-ins are not likely to get vaccinated today." That's the reality. So we are happy for high vaccine acceptance. On learning of the issue today, crowd disbursement started from as early as 9 a.m. using the RHA security systems and the TTPS, for which I am grateful. By 12 noon, almost all the crowds were dispersed. That started at around 9. It is a learning experience. What is the solution that we are looking at? And let's contextualize this in the fact that the vaccines we were distributing were the 100,000 vaccines thankfully donated by the People's Republic of China. In trying to satisfy demand, we allocated 5,000 to the Supermarket Association, 5,000 to the Trinidad and Tobago Manufacturers Association, 5,000 to construction, 5,000 to private security, targeting key populations, key industries that we need to reopen. Tobago, 2,500 Sinopharm plus the allotment of AstraZeneca. CPEP, which we are vaccinating this weekend, 5,000. Diabetes Association, they will get 1,000 next week. Homes for the elderly, 1,000. But Madam Speaker, what has happened when we asked all these associations for their estimates and they gave us these estimates? Within 1 week, they came back and said we need double the amount, but the doses aren't there at this time. So that left a few tens of thousands for the public, over 60 and under 60 with NCDs. We are going to implement a solution from tomorrow, and it is going to be a rolling thing. So from tomorrow, A to E, from Friday, F to J, surnames, Monday, K to O, and going so. So if someone in A to E does not get their vaccine tomorrow, in 5 working days, you come back again to your particular surname grouping. So it's a rolling proposal going forward. What we have also done is engage the TTPS. We had a meeting with them today, coordinated by the Minister of National Security, the Honorable Fitzgerald Hines. And the TTPS will be supplementing and assisting us with crowd control. Madam Speaker, the Honorable Member said people are not being vaccinated. And again, whilst we don't expect the opposition to support the government, be factual. The fact of the matter is, when the government set up its mass vaccination sites at Sapa, at UTT Monroe Road, at the paddock, there was nothing but compliments published in the newspapers. Those are facts. People were so pleased to go into an atmosphere with excellent customer service. So when the member says that people aren't getting their vaccines, ordinary people, that is not supported by the following figures. Because vaccinations to date, from April 7th to June 8th, you know what the figure is? Because the member said ordinary people can't get vaccines. 136,597 ordinary people who wrote letters of compliment to the newspapers, praising SAPA, praising the paddock, praising the health centers. That is roughly 10% of the population already with their first dose. For the fully vaccinated, we started the second dose administration on June the 7th. Prior to that, 1,179 were fully vaccinated. Those were mainly healthcare workers, not politicians, healthcare workers, using the 2,000 gift from Barbados. But when it was the public's turn, because the public started to be vaccinated on May the 7th, from June the 7th to June 9th, which is yesterday, the figure of 1,179 jumped to 5,896 ordinary people, Mr. and Mrs. Trinidadian, Mr. and Mrs. Tobagonian, from all walks of life have now been fully vaccinated. And that will continue every day. Madam Speaker, many countries, like Singapore, which we have said before, and other countries, have taken a decision that because they can't get enough vaccines, they will only be administering the first dose and foregoing the second dose. I don't know if that is what the honorable member is suggesting, but we have been faithful to WHO protocols going forward, and doses will always be reserved for those who have received their first shots. Madam Speaker, in addition to what happened today, and in addition to the 136,597 ordinary people who have been vaccinated, we have targeted key ministries, Ministry of Works, National Security, and other key ministries to vaccinate almost all of their frontline staff. What this current vaccination program will do is significantly prevent another wave in the future. So we accept responsibility and we have implemented a solution. Madam Speaker, whilst it is not accepted in this Westminster style of government that the opposition will support the government of the day. We expect the opposition to be an ally with Trinidad and Tobago, not to be an ally with the virus. Let us examine skillfully some of the statements made by the Honourable Member for Siparia and the lack of leadership shown. One, when we were doing well, does the country remember the statement? It had nothing to do with the healthcare system, but it had everything to do with sunshine. That was the Honourable Member for Siparia. What message was sent to people who depend on her for leadership? In speaking about super spreader events, it must be remembered that the Honourable Member from day one was advocating for open borders. What would have been the wasteland of Trinidad and Tobago today if that advice had been taken with all the variants of concern? All the legal challenges. The Honourable Member, in meeting with the Honourable Prime Minister, their main therapeutic solution was hydroxychloroquine. Hydroxychloroquine, a discredited drug where people died and had cardiac events using hydroxychloroquine. And let's not forget one of the main super spreader events promoted by the opposition when the Commissioner of Police had to stop it, and that is the issue of vigils throughout this country. For a good cause, yes, but ill-advised. Ill-advised. Totally ill-advised. And then the final solution that the opposition leader had was to build a dome over Trinidad and Tobago. So whilst we don't expect the Honourable Member to be an ally with the government, don't be an ally with the virus. Don't be a friend of the virus by putting forward conspiracy theories about sunshine, about opening the borders from day one, using hydroxychloroquine, promoting vigils, and building a dome over Trinidad and Tobago. Madam Speaker, we have engaged the private sector once vaccines became available. And we have been working with these private sector entities over a period of 3 weeks to a month to assist them in setting up their sites. They weren't set up overnight. The Ministry of Health gave them a template to work with. And yes, we will be engaging more private sector entities and more NGOs once more vaccines become available in large quantities. But right now, because we only had this 100,000 to distribute, 100,000 is not a large number. 100,000 had to stretch between supermarket association, manufacturing to keep them open, construction, CPEP, homes for the elderly. When we did the initial demand curve for homes for the elderly, we were told not more than 500 to 1,000. Today, after we allocated 1,000, they now want another 1,000. And every association has come back to us asking for double the amount. But the doses are not there at this time. I give this country the assurance, as more and more doses become available in larger and larger quantities, more NGOs will be employed. The private sector will again be more used, because we have always said from the beginning, we are in this together. But we are constrained at this time by supply and demand. The demand simply outstrips the supply at this time. So, Madam Speaker, in looking at the motion, the government's implementation of a mass public vaccination program, this was not the phase 3 of a mass vaccination program. A mass vaccination program is when you vaccinate the entire population over 18. This was a call to persons over 60 and those under 60 with NCDs. The matter is urgent because the government's public invitation resulted in a risky mass congregations that was dealt with within hours, and the potential to be a super spreader event. Madam Speaker, nothing will take away from the fact that, as I close, the opposition leader and the opposition has never been an ally with the people of the Republic of Trinidad and Tobago. Never. They have opposed, they have taken us to court at the drop of a hat. And Madam Speaker, we give the country the assurance that lessons were learned and solutions applied. We will have a rolling program from tomorrow. So if there are too many people A to E, your turn will come up again in 5 days. And so on, and that is how it is going to go until we get more vaccines into the system. Madam Speaker, with those few words, I thank you.
Member for Cuba South? Yes, the lady.
Madam Speaker, the most pathetic rebuttal I have witnessed in the Parliament of Trinidad and Tobago has come from the Minister of Health in the last couple of moments. Madam Speaker, I want to tell the Minister of Health that we on this side and the population of Trinidad and Tobago will accept no further apology, or any excuses for his incompetence over the last 6 years, and more so in the last 16 months as the Minister of Health. You come with crocodile words and hypocritical words, telling the country, Madam Speaker, that at the end of the day, vaccine supply outstrip vaccine demand, and in addition to that, it was a learning experience. Madam Speaker, how could you be going off on a frolic telling the country that this is a learning experience after the deaths of 616 citizens of this country and 27,533 persons have tested positive in this country? Madam Speaker, in addition to that, the minister seems to be a stranger to the truth. The minister is denying a front page story in one of our daily newspapers, today's newspapers, which stated the Express, 60 years and over, under 60 with NCDs, get your shots from today, walk-in vaccines, de-alcing, I want to reiterate, de-alcing, crowd control, and security in place. The Minister of Health is a stranger to the truth, Madam Speaker. And Madam Speaker, we are here today because of the sheer incompetence of the government of Prime Minister Dr. Keith Rowley and his entire cabinet. And at the end of the day, the government began a vaccination drive that was worse than a case of betrayal. It was in fact a case of COVID, Madam Speaker. And I want to ask the Minister of Health, what has happened to your database that you accumulated with all the appointments and so on? Has it collapsed? Have you admitted failure as a result of this? Madam Speaker, in addition to that, Madam Speaker, persons came out this morning before the rooster in their eagerness to do their part in the fight against COVID-19 by getting themselves vaccinated. But lo and behold, because of the incompetence of the minister, they were like the roosters, they were treated like chicken in a coop. Madam Speaker. Madam Speaker, the Minister of Health did not shed a single tear as we witnessed harrowing scenes of the most vulnerable groups led like lambs to slaughter. Those over 60 years and under 60 years, Madam Speaker, with comorbidities are people who we should have displayed care and empathy for. In fact, they were enticed in coming into a death trap, Madam Speaker. And the worst comorbidity affecting the people of Trinidad and Tobago is Minister Dialsing and the Prime Minister and his incompetent cabinet. It is sickening to see that the process that was supposed to have saved people's lives actually endangered them greatly, Madam Speaker. This is a time, Madam Speaker, this is a time, in fact, this is the second time the Prime Minister and his government has led citizens like lambs to slaughter after urging them that Tobago was the place to be for Easter. Madam Speaker, this shameless, wicked, vindictive, spiteful, criminal government is guilty of creating chaos and mayhem and madness, and Minister Dialsing must go. I thank you.
Member for San Fernando East. Member, you can speak from your desk.
Good evening, Madam Speaker. Thank you for having me. Madam Speaker, from day one, the opposition has gone out of its way to undermine the COVID fighting efforts of this government. Every single thing that we have done, they have used themselves and their agents to spread misinformation. Let me give a quick recap of what has been said by those on the other side. They have prescribed unproven drugs, which has proven to be false. They have said COVID is like a cold, also false. And then the words that will live on in infamy in the history of Trinidad and Tobago. Sunlight will kill COVID. Hasn't worked. In the other place, one of the members said, punching will cure COVID. That has also failed. Open the borders, open the bars. Something that defies every fact and every part of science, Madam Speaker. We have the member from Orapooch telling the members of the public, don't be a guinea pig by taking the vaccine, after he has already taken the vaccine. That is the kind of hypocrisy we've been dealing with. And then finally, Madam Speaker, we have the venerable opposition leader and former Prime Minister, who I expect so much more from, telling everyone to take the vaccine, but she will not take the vaccine. That is the kind of dog whistling that we've been getting from those on the other side. And that is why there's so much misinformation and confusion. And that is what the Minister of Health has had to deal with from day one. And I must say that he has done an admirable job in really disseminating the facts and also keeping his cool. Yes, today we had a misstep, but that shouldn't undermine the hard work that has been done by the Minister of Health and also by our caring and hard-working medical professionals who do not care about politics, but are concerned about saving lives. And to that, they deserve credit, Madam Speaker. Be reminded of what the Minister of Health actually said. He said it was a first-come, first-served basis for those over 60 and those under 60 with comorbidities. That is what he said. He has also said from day one, that the 3 W's should guide your activities in your everyday life. 1, wear your mask, wash your hands, and also watch your distance. From looking at some of the scenes today, that advice was completely ignored. I would like to remind the people of Trinidad and Tobago that the vaccines, though they are being produced rapidly, are still in short supply. There are 7.7 billion people in the world today. From my last check, approximately 5% of the world is currently fully vaccinated. 5%. I believe the Minister of Health said earlier that 10% of Trinidad and Tobago is at least partially vaccinated at this point. And for that, he deserves credit. The Minister of Health, yes, he has made mistakes, but he has always done his best to protect the people of this country. He has never intentionally placed the health of the people of this country
in the protocol as us. Is he allowed not to wear his mask? Oh, sorry.
Thank you.
No, it's not his best.
Madam Speaker, the Minister of Health may have made a misstep, but he has never once intentionally put the lives of the people of this country at risk for political gain. Those on the other side cannot say the same. It's amazing.
Retract that and find another way.
I retract, Madam Speaker, no problem. I may have to retract it here, but the population knows the truth. It's amazing, Madam Speaker. It's amazing how much the opposition's...
Okay, so when you retract on
Madam Speaker, I retract the statement. It's amazing how much the campaign from those on the other side seems to mimic that of the Trump campaign in the United States. And even though it concluded in the same results as that campaign. Madam Speaker, I'd like to conclude by saying to the people of Trinidad and Tobago that we are indeed sorry. But these are unprecedented times, and therefore...
The time is now spent.
Thank you, Madam Speaker.
Member for Barataria Sana. And all members, as it's 5 minutes, one can stay at one.
Thank you very much. Reckless, irresponsible, careless. Those are the 3 words that can be used to describe what took place this morning in Trinidad and Tobago as a result of the incompetence, the gross incompetence of the Minister of Health and this present government. He never said come one, he never said come all. But this morning, come one, come all, they did, Madam Speaker. You have caused, by your actions, thousands of persons to line up since 5 o'clock this morning trying to get a vaccine. You know why? Because they want to save them lives, because they are not convinced that this government will save their lives because of their incompetence. Learning experience, Madam Speaker. Learning experience. Are you playing Russian roulette with the lives of the citizens of Trinidad and Tobago? Learning experience. This is happening right now all over the world. Why don't you adopt a model that is taking place elsewhere? You come here to experiment. The lives of the people of Trinidad and Tobago are important, and you ought not to experiment with the lives of our citizens. Don't do that. Today we heard only, Madam Speaker, distractions, excuses, but no responsibility for his actions. None. None whatsoever. The only action that this minister should take now is to tender his resignation to the Prime Minister and vacate his office. Madam Speaker, in no other civilized democracy will any Prime Minister tolerate that type of gross incompetence and keep a person like that in his cabinet. Madam Speaker, we are right now witnessing one of the deadliest deadliest and most infectious wave of this COVID-19 virus. We have been told that the dominant strain here is the P1 variant, Madam Speaker, yet you had elderly persons over 60 years, many of whom may have comorbidities, lining up for this vaccine, only to be turned away because the Ministry of Health, under this Minister of Health, did not properly organize a system for these persons to get their vaccines. Madam Speaker, do you know that they had persons lining up from 5 a.m. to 12 p.m. today, but it only takes 15 minutes for you to become a primary contact? 15 minutes. You have placed the lives of our citizens and our elderly at risk. You have done that. The vaccines were told that it is the solution. We were told that the vaccines is the solution. But this government made the vaccines a problem. Madam Speaker, the minister came here to talk about letters to the editor. Oh, praise me, praise me. But what happened today? You have put the lives of our citizens at risk. Any person who is infected because of your irresponsibility today, or any person who died, must be bolted to your chest because it is your incompetence that caused that, Madam Speaker. That is the responsibility of the Minister of Health. He must accept that responsibility. Madam Speaker, it is too late to apologize for the state-sponsored super spreader. It is too late. The minister has no moral authority to stand in this parliament and apologize, Madam Speaker. He must go. He must go. Madam Speaker, we have countries right here in the Caribbean who are doing vaccine drive-thrus. Why doesn't the minister implement this? Madam Speaker, the behavior of the minister this morning justifies the reason why the opposition leader is right to call for a commission of inquiry into the actions of this government relating to the COVID response, Madam Speaker. This justifies that commission of inquiry because persons in this government, because of their negligence, their incompetence, must be held to account and must be held liable for what has taken place with the destruction of our economy and the loss of lives of our citizens of Trinidad and Tobago, Madam Speaker. And I thank you very much.
Minister of Energy and Energy Industries.
Thank you very much, Madam Speaker. Madam Speaker, it's disturbing to any sensible person to have to listen after 14 months of the unfortunate arrival of COVID-19 into Trinidad and Tobago, to every single occasion, without exception, the opposition seeks to undermine every response and positive response to combating COVID on every occasion.
Speaker, on a point of order, 48.6.
Continue.
Irresponsible, destructive, pure contempt for our citizens. I remind the population through you here this evening, Madam Speaker, that the UNC were the first people, the opposition were the first people to discourage citizens from taking the vaccines. Bolt that to their chest. The member for Oropuch East was one of the first people to try and undermine the use of Sinopharm that right now we have citizens clamoring to get. Embarrassingly so, Madam Speaker, let the population be reminded that two former members of Parliament, who the member for Siparia rejected, fired.
Madam Speaker, 48.1, the relevance, please.
Oh, get real. The former members of Parliament had to come out and break ranks with the strategy of Siparia. Dr. Gopi Singh and Suraj Rambachan, to tell the population, ignore the hogwash coming from the opposition and go and take the vaccine. The most embarrassing position for a leader, to have two persons she rejected, didn't allow to go to the polls, and they are the first two on that side to come out and say to citizens, ignore what she has to say, what the member for Siparia has to say, and take the vaccine. It continues to distress every civic-minded citizen in this country that the opposition continuously delights in any issue in this country and any issue that this country faces, I have never seen a bunch of people who are happier to see our country burn than the UNC. And that is why the population rejected them.
Madam Speaker,
in August of
48.6, please. 48.6.
They can't handle it, but that is why the population rejected them time and time again. And to come here today to use an unfortunate incident to try and score political points is again a complete abuse of any trust that anybody put in them prior to today. This is an opposition where we've witnessed time and time again, even standing up here today, each single member of the member for Siparia standing up in a presentation today again, telling the population, if I were the Prime Minister, I would have vaccinated everybody. It immediately got me thinking, I wonder where they would have gotten the vaccines for. Because you see, it is an irrefutable fact that vaccines could not be obtained prior to the times they were obtained today. This government has put the Prime Minister on Saturday gone, went through the lengths of once again repeating, showing through irrefutable evidence, vaccines weren't available. The first cry we heard was, bring vaccines from India. India were not permitted to sell vaccines. We saw that up to April of this year, they could not sell vaccines. As soon as things spiraled, unfortunately for our brothers and sisters in India, that conversation went flat and died. So all I am saying and contributing and adding to here this afternoon, this evening, Madam Speaker, is let the population know that this government is doing everything it can, as it has been doing since January last year, to respond to COVID-19 and the global pandemic that we're facing. And with the current vaccination scheme, we have vaccines coming. We continue to pursue vaccines at every single level. And it really is heart-wrenching to witness those on the other side time and time again come and try to undermine everything that is good in this country because they are not in power and they will not return to power. Thank you very much, Madam Speaker.
Thank you very much, Madam Speaker, for the opportunity to join. May I begin by first congratulating the Leader of the Opposition for bringing this motion today to debate on this day, one of the most important and yet tragic events that this country has seen since the outbreak of this pandemic. Madam Speaker, today the opposition leader brought a motion to speak to the vaccination program, to speak to the issue of the chaos of this day. The government response is to debate the opposition. We are here to debate vaccines and COVID. They are here to debate the opposition. Since the member for Portishead North, St. Anne's West had a regrettable fall off a stage in Penal, his head has twisted upside down as it relates to debates in this House. Madam Speaker, the member is obsessed. He's obsessed with personal attacks against the member for Siparia and other members of this side and failed to deal with any issue or any policy. And I suspect that fall in Penal has something to do with it. Madam Speaker, today it is critical. Now, I just want to take up an issue quickly that was raised by the member for Siparia. Very important issue that you went ahead, indicated, walk-in, time to come, we have the vaccines. They have 20 vaccines and invited 2,000 people. That is the problem. Why the minister and his ministry, armed with a communication department, could not tell the people clearly, listen, we don't have so much vaccines. We simply don't have. But the government wanted to give the impression. If you remember the press conference they had the Saturday before, the Prime Minister spelling out vaccines coming from the USA, 400,000 coming from China, coming from here, coming from there. They set in train an expectation that there are vaccines for all. That is what they did. So today, when they mark bus, to use a local slang, we discover that really they have no vaccines. So you call people to come out and you have no vaccines. The elderly with sticks standing up 5 o'clock in the morning. and you're calling them again, tomorrow the same thing will happen. Because whether A to E, D to F and G, it is the same problem. If you have 5,000 vaccines, what will happen when 10,000 people come throughout the island? And clearly, as the opposition leader said, that is not a well thought of plan, because you thought of that this morning when you boss. When your program collapsed this morning, you didn't say ABC. Clearly, you had no thought for that. There's another possibility that the minister just failed and ignore. You do not have vaccine, so stop telling people you have vaccine. Let me start with that. You have none. You have a few. Why don't you use the existing institutions like the county medical officer, the health centers, where they already have a database of persons with chronic illnesses who go there as clients? Allow them to call the same people and give vaccines to that critical group that are already in the healthcare system. You don't advertise, walk in, walk in. We have it for you, vaccines, 100,000 coming. So people quite clearly walk in. And when they walk in, you get the same Easter effect. You got then, you got today. And the minister comes and say, we're sorry. We're sorry what? When the infection rate go up and the death rate go up, you sorry for that? You sorry? What do you think? What do they think it is? So Madam Speaker, this is a disaster in another 17 today dead, 454 infected. Those people, something is happening and it's not state of emergency and curfew. Why are people dying every day like this? Is there a problem in the ICU? Is there some problem managing patients at home? The minister will not speak about this. All he will tell us is walk-in didn't mean everybody. Well then, could you please tell A to E that you have only a few vaccines and do not come out tomorrow?
Attorney General.
Speaker, I thank you.
Madam Speaker, I simply rise to reject the outlandish recommendation coming from the Leader of the Opposition. Let us go into the facts. Number one, there is a vaccine program afoot. Number two, if you look across the world, the methodology demonstrates that there will be ebbs and flows. We can look further to the fact that certainly demand exceeds supply at this simple point. We can also anticipate that the position will be managed as the vaccine numbers increase. To listen to the Leader of the Opposition call for the resignation of the Minister of Health, saying that the minister must walk with a letter prepared by the Honourable Leader of the Opposition, is a most curious recommendation coming from a leader who birthed life sport, a leader who birthed Section 34.
The relevance, Madam Speaker, 48-1.
When we look to the point
48-1,
of
Madam Speaker.
Resignations being called, Madam Speaker, we cannot take the architect of Reshmi Ramnarayan seriously on any call as it relates to COVID.
It is not the motion.
When we get to COVID, Madam Speaker.
Okay, Attorney General, back on track.
The resignation for COVID has to have grounding by, first of all, coming from someone with the respect and moral authority to call for resignation. And most importantly, the Leader of the Opposition has no moral authority to call for anybody's resignation, especially on the issue of COVID. Not when that honourable member of Parliament has been at the forefront of pushing, in particular, litigation to turn this country upside down.
Again, Madam Speaker, 48-1.
Honourable members, the debate on the adoption of the report by the Standing Finance Committee, which was postponed at 6 p.m., shall now resume. Leader of the House.
Thank you very kindly.